20th of October. Now, I want to deal with a question that's been cropping up repeatedly in emails and comments, and this is people being concerned about the Delta variant plus, so-called. Is this a concern? Well, the answer, the bottom line to this video is it is a bit of a one, but not a huge one at the moment. So let's look at the data on this first of all. Now, the most definitive data on this comes from this update here from the UK Health Security Agency. I think that was Public Health England until not long ago. SARS coronavirus 2 variants of concern and variants under investigation in England. Technical briefing 5 days ago, 2021, technical briefing 2025, and the full report with all sorts of graphics and interesting things to work through. It'll take you about 2 or 3 days probably to work through it all, but it's all there if you want to get it, and that's where some of this information comes from. Because this is a fairly new topic, we're still getting some information from news sites as well. So let's dive in. New descendants of the Delta variant. Now remember, this is a Delta variant, but it's a descendant of the Delta variant. So it's like a subtype of the Delta variant. Now, as of the 11th of October, a few days ago now, of course, but Delta was the predominant variant by way of background, 99.8% of sequence cases in England and pretty well in all of the UK, and indeed pretty well in the United States and pretty well everywhere else, actually, because this is now the overwhelming majority variant, the Delta variant, first arising in India, of course. So virtually all cases are Delta variant, because the Delta variant, so much more transmissible than previous variants, it has basically outcompeted the lot of them and become the dominant variant on the planet. Very successful variant in evolutionary terms. Now, Delta sublineages, newly designated as AY4.2, this is the one we are worried about, and we'll look at how we get to that AY and the 4.2 in a minute. So this is the Delta variant plus the AY4.2. There's also a small number of new cases in the Delta with this mutation, where the E amino acid has been changed to the K amino acid at the 484 position. And there's other variants where the E amino acid has been changed to the Q amino acid at the 484 position. So what we're trying to say here is this is not the only variant that's going on within the Delta subcategory. There's lots and lots of variants arisen by mutation within the Delta variant itself. So this is not something dramatically new in that sense. Lots of references there. That's the government reference there. That's one of the other government sites. And these are a few news outlets that we've taken information from. Do feel free to browse them. They are mostly consistent, mostly fairly well written. That's why I've used them, of course. Now, the genetic sequencing, the genomic sequencing in the UK, looking at all the individual base letters that make up the virus. In the UK, it was indicates that this new variant, this Delta variant plus this AY4.2, represented about 6% of cases as of the 11th of October, when this paper was published. That one, but now it's a bit more, unfortunately. Now it's probably nearer 8%, and some people are saying up to 10%. So it is definitely becoming a more prevalent subvariant of the Delta variant, and we are going to look at why that matters. Now, UK sequencing is pretty good, certainly compared to the United States, where it's pretty poor. They did make some improvements in the United States a few months back, but it's still, for the size of the country and the amount of people and the amount of scientific brilliance in the United States, the amount of genomic sequencing they're actually doing of the virus is pretty pathetic. So they are doing some, but nowhere near enough, really. But the UK, we've sequenced over 1 million performed so far. So we've performed 1 million sequences. So in the UK, we're pretty well on top of this. This is sometimes why that new variants are discovered first in the UK or Denmark, because we're just sequencing so many cases. We're likely to pick them up. Now, here we have the trajectory. It's an increasing trajectory for this Delta variant plus. And here's the graphic here. So this is 100%. This is all Delta variants here. And then we come down to this new Delta variant plus. Now, it was recognised quite a while back. Really, it was actually named there, the AY 4.2, in July? That's August, isn't it? So, and since then, very gradual increase before then in terms of cases. Now it is increasing more rapidly. So as we say now, we're about 8 to 10% of sequenced cases. And it is believed that this is representative for the country as a whole. So all the other Delta variants are still the majority, but there's no question that this is on an increasing trajectory, as we see there. So an increasing trajectory of the new variant. Now, it's been identified in the United States. Yes, it's been identified in the United States. Now, Michelle Walensky was commenting today that there's no clusters of this that they know of in the United States, but there again, there's little genomic sequencing in the States. So she might not know that anyway. But there are some cases. There's been 3 cases sequenced in the United States. No clusters reported, according to Michelle Walensky. So 1 case in North Carolina, 1 case in California, 1 case in District of Columbia. But we can assume that there's many others. And the reason we can assume that is that in Israel, they've now sequenced 10 cases of the Delta variant plus. 10 cases in Israel. And the Israeli authorities, at least from fairly reliable news reports, are saying that all of those cases from the United States. So it looks like the good quality surveillance in Israel has picked up 10 cases that had been missed by the United States. So only 3 sequenced in the States, but 10 in Israel sequenced, and they are all from the United States, indicating there's quite a few more in the States. Now, the UK, it's up to about, as we say, 8 to 10% now. So 14,247 sequenced as of the 18th, as of 2 days ago. So they're the number of the Delta variant plus cases that have genomes that have been sequenced so far. That's for all of the United Kingdom. Now, it is a change. The AY Delta 4.2, the Delta variant plus, it is a change on the spike protein. So it is a spike protein change, which of course is the concern. And of course, that means that the virus can potentially evade the antibodies that have been generated to it, that bind to the spike protein, which are generated by the vaccine, of course. I mean, both of the vaccines, the Oxford AstraZeneca, the Moderna and the Pfizer, that's 3 of the vaccines, they all target the spike protein. So there is a concern here about vaccine escape, but it's not looking like it's very prominent at the moment, and I'll tell you why that is. Now, just a bit about the nomenclature here. So AY, if you see AY, that means Delta variant. And of course, the Delta variant happily mutates away because all of these variants do. And so there was an AY1, an AY2, an AY3, an AY4 variant. So the AY4 variant is actually, the AY4 is 80% of the cases in the UK already. So 80% of the Delta variant, so basically all the cases in the UK are Delta variant, and 80% of those cases are the AY4. So this AY4, so we've got AY meaning it's Delta, it's variant 4, and this is subvariant 2, so it's 4.2 is the correct way to say that, AY 4.2. And the mutations involved here, 2 main mutations. The Y amino acid, that's the tyrosine amino acid, has been changed to the histidine amino acid. So the tyrosine has changed to the histidine, the Y to the H at the 145th position. And the alanine, the A amino acid, has changed to the valine amino acid at the 222nd position. So that's an alanine to valine mutation. So it was the tyrosine, it's now the histidine. It was the aline, it's now the valine. So they're the 2 changes, but they are both spike protein changes. Now, this particular change has been found in other lineages since the beginning of the pandemic. Now, I do remember that this was found in the alpha variant. This particular mutation was found in the alpha variant, but didn't become predominant. So it didn't give the alpha variant a massive boost. So hopefully it won't give the Delta variant a massive boost. But of course, we don't know that for sure because the Delta variant was basically buried by the avalanche of the Delta variant. So even though that change had taken place in the alpha variant, there wasn't really time to find out what it would do. So the question is, will this give the virus additional powers? Will it make it more transmissible? Will it allow a vaccine escape? Well, the vaccine escape, there is a slight effect on the binding between antibodies and the virus. So this new configuration on the spike protein here So there's the new mutation. There's one of the new mutations there, and there's another one there. They do slightly reduce the binding of the existing antibodies to that, these Y-shaped molecules. That's the active end of the antibody, the Y-shaped molecules. So remember that the antibodies are these Y-shaped. So what I've drawn there is a big blow-up of that. So these antibodies are these Y-shaped molecules. These are immunoglobulins. And it's this end bit here, blown up here, that bind onto the spike protein. And that one is a neutralizing antibody that would basically block up the spike protein. So what you would end up with is if you have the virus there like that with all these spike proteins on it, then the neutralizing antibodies, what they would do, like the ones produced by the vaccine, is basically they would basically bind onto that like that, and that would stop the that would make it harder. The fact that an antibody was stuck there would make it much harder for that to fit into the ACE2 receptor site. So when it tries to get into the ACE2 receptor site here, basically it doesn't fit in anymore, because this if that's the cell there, it doesn't fit in anymore because this antibody's in the way. It's a neutralizing antibody. So there is a slight effect. So there's reduced binding between the antibodies and the virus, but it's not a huge effect, but there is a slight effect. Now, this is not yet a VOC, but it's a VUI. It's not a variant under investigation yet either. So it's not officially a variant of concern, and it's not officially a variant under investigation yet. But in the next few days, the World Health Organization will authorize this as a variant under investigation, and they'll call it the new variant, I would predict. If I was a betting man, which I'm not, I would say they'd call it the new variant in the next few days. So we'll feed back on that. I think that will happen. Now, the original Delta was classified as a variant of concern May 21, and this was originally identified in July 2021, as we've said. So 2021 for the Delta. Then not long after that, this cropped up, and then it started to increase, as we noted, pretty gradually over that period of time. But an upward trajectory, no question of that. So as we've said, it's 4.2, so it's a sublineage. It's a sublineage of the Delta variant 4. It's a 4.2, and it's been increasing slowly since it was identified. Now, Professor Francosis Bailu, University College London Genetics Institute, says this. It's potentially marginally more infectious strain, marginally more. And that makes sense because it's been increasing gradually. So it didn't take over like the Delta variant took over from the Alpha variant, or the Alpha variant took over from the original wild type variant. Not a massive difference, but that edge of evolutionary advantage, just that slight survival advantage, just that slight increase in transmissibility has meant that it has increased in prevalence over that few months, as we've said. Professor goes on to say it's nothing compared to what we saw with the Alpha and Delta variant, which was something like 50 to 60 times % more transmissible. And of course, the Alpha variant hit us like a tidal wave, like a tsunami, and so did the Delta replacing the Alpha. So it's not like that. So we're talking about something quite subtle here, and that is currently under investigation. Now, it's not a variant under investigation, but it is under investigation, although it's not officially a variant under investigation. It is being investigated, if that makes any sense at all. It's not classified as that yet, but it will be in a few days' time. At this stage, I would say wait and see, don't panic. It's not something absolutely disastrous like we saw previously, so we agree with that. So the message we're getting here is that there's an element of concern. There's a slight increase in transmissibility, but it's not a massive difference like we had a whole wave caused by the Alpha variant and then a whole disastrous wave caused by the Delta variant. It's not like that. But I think we can say it's increasing throughout the world. This will be increasing in the States. It will be increasing in Europe, just that we picked it up first. And it's been picked up in Denmark. Now, it's no coincidence it's been picked up in Denmark first, because Denmark leads the world in sequencing 100% of positive PCR tests. It's incredible. So that they're sequencing more than any other country in the world. Now, the UK is sequencing the largest number of individual genotypes in the world, but Denmark is sequencing the highest percentage for the cases that they have. So it's no surprise that this was picked up first in the UK and Denmark with their Danish 100% coverage. If it's there, they'll get it. It's guaranteed that they'll pick it up. Now, Professor Jeffrey Barrett, in combination agreeing with Professor Ballox here. So these two are in agreement. AY 4.2 could be 10 to 15 times more transmissible than the original Delta variant, is their sort of consensus of opinion. Now, we know, actually, I mean, this is the topic of the next video probably, but the Health Secretary today has said that the new cases in the UK in the next month could rise to 100,000 new cases per day. The cases in the UK are absolutely taking off really pretty exponentially at the moment. Huge numbers of new cases in the United Kingdom. The United States, the cases are going down, but they're testing much less in the States as well. So the position in the States is not that clear. Thankfully, it's not being transposed into massive amounts of hospitalisation, but they are concerned that hospitalisations in the UK will go above the 1,000 a day, which is really getting quite a strain, more so than it is now. And the other reason I think that the cases aren't going down in the United States as rapidly as the figures would suggest they are in the States is because the hospitalisations in the States are dropping off more gradually and the deaths are dropping off more gradually still. So I think there's a bit of a mismatch here between the lowering numbers of cases in the United States and the not as dramatically lowering number of hospitalisations and the certainly not as dramatically lowering number of deaths. So it could be a testing issue there. So is this new variant, this Delta Plus, the 4.2, is this accounting for the spike in cases we're seeing in the UK at the moment? The answer is no. It doesn't seem to be. It doesn't seem to be. Because most of the cases are in school-aged children and they're catching the virus at school, spreading it amongst each other and taking it home to their parents' generation. And if you think about it, if it's, say, 10% more transmissible and it's only 10% of cases, then that means it's only accounting for about 1% of new cases in the UK at the moment. So it's not accounting for this massive spike that we have. That is accounted for by the way we are currently choosing to live in the United Kingdom, as we've discussed before, I think it's fair to say, on this channel. So brief up-to-date today. Hope that helps. What's going to happen? Well, yeah, it is going to increase in prevalence. This could end up being the majority subtype of the Delta variant because basically it is outcompeting the other variants. It's outcompeting the Delta variant 4, the 4.2 is outcompeting that, and it's outcompeting the Delta 0.1, 0.2, 0.3, etc. So it will become more prevalent, but because it's not massively more transmissible, it will increase in prevalence, but it probably won't become overall dominant before we can get this this wave under control with community and herd-based immunity. So yeah, the message was said there by the professor. No need to panic about it, but we will be keeping an eye on it. The other interesting thing here really is how much more can this mutate. Now, there is a limit to this because very often what you find is if the virus mutates in a way that makes it more transmissible, that is not necessarily making it more pathogenic, ability to cause illness. In fact, very often it can be the opposite. It can cause less severe illness. There's no reason why they should go together necessarily. They shouldn't. It depends on the configuration of the spike protein and the receptor site, but not necessarily. And likewise, if a virus is causing more severe disease, if it mutates to cause more severe disease, then there's no reason why it should be more transmissible. So it's kind of a trade-off in the virus. You tend to get more transmissibility, although the Delta variant did cause more illness, of course, but that's a bit unusual. That's why I've had such trouble with the Delta variant. So are we going to keep seeing more and more mutations is another question I get. The answer is no, I don't think we are. There's a limit to how much this virus can mutate. It is still a SARS coronavirus 2. It's not mutated into something else. It is still a SARS coronavirus 2. It hasn't become a H1N1 massively transmissible, different type of virus. It's still a SARS coronavirus 2, and there will be limits to the way that this genome can reconfigure itself. But because there's so much virus around now, any little evolutionary advantage is being used to increase the prevalence of particular fitter, to use the correct evolutionary terms, fitter variants. I think that's what we're seeing, and I'm not overly concerned about it. And the overwhelming consensus of opinion at the moment is that the vaccines we are currently using will carry on being efficacious against this variant. So I hope that helps, and thank you for watching.